Hello friends, today we are going to talk about diagnosis of myasthenia gravis. So if we'll go by history wise, then myasthenia gravis patients are giving history of diplopia, ptosis, dysarthria, dysphagia and dyspnea. There will be the weakness which is mainly concentrated on proximal leg. There will be weakness of neck extensor and the patient might give you history of generalized weakness. There will be the fatigue, which was worsened with repetitive activity, but fatigue will be improved by rest. So if we go for physical examination, then there will be the ptosis at rest or following and following 1 minute of exercise, then extraocular muscle and there will be subjective diplopia, orbicularis oris oculi and the oris strength will be reduced, jaw opening and the closing. Then we have to go for the assessment of muscle strength in the neck and extremities. There will be the weakness following repeated shoulder abduction. We need to measure for the vital capacity as it might be reduced, and the other neurological signs will be absent. If you're talking about the lab test, then we need to send for the anti-acetylcholine receptor antibody, which are positive in 85% of patients with generalized myasthenia gravis and 50% with ocular myasthenia gravis. Please note, if anti-acetylcholine receptor antibodies are positive, then we can say it's myasthenia gravis. But if it is negative, then that doesn't exclude myasthenia diagnosis of myasthenia gravis. So please note that 40% of acetyl, if in 40% of patient, if acetylcholine receptor antibodies are negative with generalized myasthenia gravis, so other antibodies are anti-musk antibodies and 2% have LRP4 antibody. So if it is found that in 40% of patient in whom acetylcholine receptor antibodies are negative, then they showed anti-musk antibodies. They showed positive result for anti-musk antibodies. Then the next test is repetitive nerve stimulation, which showed decremental response of more than 10% at 3 hours. Then single fiber electromyography, which is confirmatory but not specific, and we can go for hydrophonium chloride test. The next test that we can use is ice pack testing, which that means if we apply ice pack, then there will be the improvement in the ptosis, and it is very sensitive test. For ocular and cranial myasthenia gravis, exclude intracranial lesion by CT or MRI. Thank you, guys.